I want to talk about two dimensions of CHIP that I think sometimes don't get the attention they deserve. And having heard the last answer about the kid glitch, in my mind, it's even more imperative. Mr. Leslie, in your testimony, you mentioned something that I don't think gets enough attention when discussing CHIP, and that is the impact it has on reducing racial and ethnic disparities and the success of the promotora style models of engagement. As a matter of fact, this past Sunday, Nicholas Kristof and Cheryl Wudun published an article in the New York Times highlighting the benefits of early intervention with pregnant women and newborn babies. And Mr. Chairman, I'd ask unanimous consent that that article be included in the record.
So ordered.
It highlights the substantial benefit to children and families from early intervention and home visitation. For example, these early intervention programs resulted in a 79% reduction in child abuse and neglect, a greater than 50% reduction in arrests later in a child's life, and more than 2 fewer years on public assistance programs. So if you combine those evidence-based programs offer nearly a $6 return for every dollar that we invest. And the article also highlights the work of the Nurse Family Partnership, a group that I've worked with extensively on the maternal, infant, and early childhood visitation program, and which provides women and children with incredibly important and successful services. So that's a big preface, but what I want to get from you is, can you speak to the impact on children starting at childhood and moving through adolescence when they have access to services like home visiting alongside other healthcare services as well?
Yes, thank you, Senator Menendez. First and foremost, too, I would also like to acknowledge an amendment that you offered that was so important in all of this, which is the child-only option, which was, I really recognize that children and families often have coverage separate and apart from their parents. Their parent may be a veteran and have VA care, but the child gets coverage for other children who have been abused and neglected may have kinship care. So their grandparents may be on Medicare, but they need to get CHIP coverage. And so that amendment has been huge, and we're really working to try to make that work. But CHIP and Medicaid have had enormous impact on health disparities. And I would note a National Institute of Medicine report in my testimony that talked about some of the impact on disparities. There's also reports from the CDC that talk about that in ASPE. But the coverage differences has been remarkable, that we've really shrunk the disparities in coverage. And I would note exactly what you've said is, and Dr. Perrin's testimony, and I answered the questions, is this importance of prevention. And NFP has proven for every dollar you spend, you save enormous amounts of money in long-term savings. And it's a medical model, and where nurses go into the home. And we really believe that it has really served the combination of the Medicaid and CHIP in partnership with things like NFP. And also, as you mentioned, the community health workers or promotoras program. When I worked for Senator Bingaman, there was a grant that went to a promotora program in Las Cruces, New Mexico. And they had a target of trying to reduce the uninsured rate. I think the uninsured rate in Las Cruces was something around 35%, about a third. And literally these two women got this grant and went from county fair to county fair doing the outreach that Senator Rockefeller was talking about, doing the outreach to the community. And they had a target of X, and they actually exceeded it. So at the end of the day, we were laughing because it was, so you have 102% of coverage in Las Cruces now. It was enormously successful, and not only was it successful in getting coverage to people, but it was also helping families navigate, which is another bill you've done in the past, which is patient navigator. So really helping them navigate the healthcare system, and it was huge. And the people in Las Cruces were, and the combination of those things working together.
Well, I appreciate it. Part of our challenge when we score here is that I wish we were score in ways in which we recognize the upside, like the ratio that I just described, so that we could factor that in. If I may, Mr. Chairman, one other question. Dr. Perrin, first of all, I want to thank you and the Academy for the work that you did with me and with the Senator Enzi on the Autism Care Act earlier this year. I think it's incredibly important. And as you know from that, the state of New Jersey has the highest incidence of children diagnosed with an autism spectrum disorder, 1 in 49 receiving a diagnosis by the age of 8, compared to 1 in 68 nationally. Providing resources for children with autism and their families is one of my top priorities, and we're elated that the President signed the Autism Care Act into law, which continues some critical federal autism programs that were set to expire, and a provision that I included in the Affordable Care Act requiring autism services be included as essential health benefits in all new marketplace insurance plans. But I want to see if you can help me discuss the role that CHIP plays in providing critical behavioral health and autism services to children, and how does that help and intervention impact a child with an in the autism spectrum disorder in terms of how we maximize whatever their God-given ability might be, and how does it affect them as they grow up?
Thank you, Senator Menendez, and thank you so much for your incredible advocacy for the Autism Cares Act. We're really grateful for that. We think that's an incredibly important act for America's children and is doing really some extraordinarily important things. You know, I've been talking about prevention and early intervention all afternoon. I think it's really the critical part of it. We know in an area like autism that it's really critical that we provide services early on, because the brain is still more plastic in a child who's 6 months or a year old or 2 years old than a child who's really over the hill at age 5. Not really, of course, but still, that it's really critical to provide, to identify kids early and to get them the kind of early intervention services. And you mentioned before home visiting as well. It's an area that we've been incredibly supportive of as well. And it's one where we're working very much to integrate and really connect much more actively what's happening in home visiting and what's happening in community-based pediatrics. So that because we're working with the same families, and we're trying to make sure that the communication is really going well in that context, and that we're using that opportunity to, again, to build community linkages, link families with resources, and try to help families find the kinds of resources that let them do better. CHIP is really very important, because the benefits in CHIP are preventive and child-oriented benefits. Yes, indeed, we wanted the Affordable Care Act to have similar benefits through the exchange plans, but as we know well, as the exchange plans have been implemented in large numbers of the states, the benefits for children, especially in behavioral areas and habilitative services, are not really very good. The CHIP benefits are substantially better in those realms. That's one of the reasons that we're really strongly advocating for the persistence of CHIP here. We will work to make the exchange plans better, no question about it. But right now, the benefits for children in exchange plans in general, very much state options, as you know, are not great. So that's why we're really very committed to the CHIP as an important preventive benefit for children.
Well, I appreciate that. Thank you, Mr. Chairman.